conducts both cardiology and dental quiz. We welcome you, sir.
Thank you. Can I go ahead again, Vasudha, or do I have to wait for somebody else to make another announcement?
No, Prabhakar, it's now your turn. Can we have spotlight on the speaker, please?
Yeah, fine. Right. First of all, I should thank all of you for having me here on during these COVID days when everybody is stuck at home. But actually, it's nice to sit at home and give a talk and give lectures. I'm getting used to these webinars. When I start first one, I was pretty skeptical, and then it became quite used to it. And for this one, I should thank Vasudha for giving me an opportunity to talk with her family of Rotarians, as she calls it. And thank you very much for the kind words from Mr. Selvan and for the person who introduced me. Thank you very much. What I shall try to do over the next about 20 to 30 minutes is try to stick to your own concept of the Healthy You series on cardiac care. So I actually practice more of preventive interventional cardiology. What it is, as I talk, I think you will get to know more about what I mean by preventive interventional cardiologist. Basically give you an overview about the heart. Basically, heart is actually not one, it's two hearts in one. Like it's both hearts fallen in love, and you have the right heart and the left heart stuck together, as you see in this panel here, as you see here. And these two hearts have two distinctive functions. The blue color is the blood that comes in and goes to the lungs, get oxygenated, comes to the left heart, and then subsequently goes to the rest of the body with oxygenated blood. So you have two hearts in one, and whenever there are two hearts, people fall in love. They also have a breakdown, like in families, they have problems, and that goes on and so forth. The heart lives in houses, and you can compare the problems in the heart to a house. So when you have a house like this, what all are your essential things? The first thing is the structure of the house. The second, you have a very important electrical supply. Third one, you need water supply. So you look at the heart, basically the heart also is something similar to these houses, and you have three issues. What is the overall heart? The pipe supply, which is the blood supply, which goes in small pipes or the arteries or the blood vessels, as we call it. It has also got a very important electrical supply inside the heart. So you have problems in all these three. When the heart doesn't function well, that's when people call it as heart failure. When the pipe blood supply is not enough, not adequate, and it happens slowly, people start getting a pain on exertion, you're comfortable at rest, but when the blood supply is not enough for you to do any activities, you call it as an anginal chest pain. And the third thing is the heart attack, when people present dramatically with a severe chest pain, which all of us are familiar with. The electrical supply can also have problems similar to what we have in the house. Either the electricity gets cut like in the form of blocks, or sometimes you have short circuiting wherein the heart beats very fast, which we call it in clinical parlance as palpitations. We will not talk much about the electrical supply and the overall heart functioning. That we will probably take in questions if required. What I shall be focusing is in the major chunk of the heart problem, which is going to be the heart attack, and that is going to be the thing. What I thought I will take you through is one of my patients who came to me about 4 years ago. Now this guy was 24 years of age when he came to me. He was referred to me just for uncontrolled hypertension, and his general practitioner felt that his BP was not getting controlled, EC was abnormal. No major issues. He was non-smoker, non-diabetic, normotensive, no family history of heart disease. He was generally feeling unwell and his BP was not under control. Echo showed signs of a heart attack. And when I did an angiogram, he had one major vessel that was totally blocked, and I had to do an angioplasty for them and become all right. Now here you have a 24-year-old guy who presents with chest pain. So this does not have a classical pain, but some kind of a vague fatigue. So the first question we're going to be looking at is, in a dramatic presentation like a heart attack, what is going to be the common mode of presentation? All of us know that when somebody keeps their hand over the chest and compresses severe chest discomfort, it could be heaviness, it could be choking, sometimes pain, it could be burning sensation. And we all always know, I think everybody remembers that, at least if you don't remember that, you'll remember Sivaji Ganesan always telling you, so that is a classical sign of having a heart attack. And so you have a left-sided pain, but mind you, it is not the left arm alone. The jaw pain is pretty important. Some people have just jaw pain that could be there sometimes on the left, sometimes the whole jaw could pain. But when is it important? Not all pains are significant. Usually, when you have a heart attack, the pain lasts for more than 15 minutes. It may or may not be associated with sweating. Now, why does Mother Teresa figure here? Mother Teresa figures here for two important reasons. Mother Teresa is old and she's a lady. The women and the older people don't have these classical symptoms of heart attack. What they have are the atypical symptoms. There are people who just present with excessive nausea, vomiting sensation, tiredness. Some people just present with giddiness. Sometimes they even lose consciousness. Breathing difficulty, fainting, confusion. All these are atypical presentations. In fact, one of my classmates who's a cardiologist, his father just kept yawning sitting in the dining table and he had a nauseated feeling. He went and took up an ECG for him and diagnosed a heart attack for him. So these kind of atypical presentations are also there. Don't ignore. Now, if you have these things, what is the thing that we can do? The first thing you remember, time is essence. Time is muscle, and the more time you lose, more of the heart muscle you lose. Don't exert yourself. Try to put yourself back. You remember the old 10-time easy chair that is there? Put yourself back, not sitting straight. A little bit of back supported in about 45 degrees angle. If you feel faint, make them lie down. Get them to the hospital as early as possible. If they are known to have a heart disease, you have an aspirin tablet or a tablet that they keep under the tongue. I think all of you should be familiar with the tablet called Sorbitrate, which is there. Or if they have a little Gelusil, you can give it to them. If you feel faint and if you're alone, I'm sure all of you have seen those WhatsApp videos that have been going around saying cough. It does help. Like if you're alone, if you feel faint, when you start coughing, when your heart starts beating very fast, the cough actually pushes the blood into the heart when the blood supply is not enough. It is helpful when you have a faint feeling, but otherwise you don't have to cough and don't think. It might retain your consciousness till medical help arrives if you're having a fainting feeling. Now, this gentleman's story didn't end there, because what happened to this guy was he came back to me again after 4 years. This time again with chest pain, and when I did an angiogram for this guy, this is what it showed. Now, if you see this angiogram carefully, you will start realizing something in this. You'll see that this is how a blood vessel looks. And if you see this here, there is a thin strand of blood going in. These black spots are the blood vessels. This is what happened. He came back with chest pain again. So what happened? I had to talk to the mother and ask him what happened to him. This guy has not been having good money, so he's been missing drugs. This is what he said. But when I asked the patient, he told me one very simple reason. He said he stopped drugs. And when I asked him, why did he stop the medication? He had a very simple reason. Can you guess what it was? He had a very, very simple reason. He said, I felt bored of taking drugs after 3 years, so I stopped the drugs. Please don't make the mistake, because these heart attacks, we don't cure you of the disease. What happens? We just correct the disease, and there is a very strong likelihood. Now, mind you, at 28, he had a second attack, and this is what the block looked like. And I had to go ahead and fix him up again. Now, I tried aspirating, thinking that there was a clot inside, didn't work. And ultimately, this is what we had to do. We had to open up the vessel with a stent, and once we put a stent like this is how the vessel looked at the end of it. You see this black spot here? The vessel looks clean and pristine, and this is what happened. He had a very clean, good flow in these vessels. Now, this is how the heart attack comes, and this is the classical management. If you come early to the hospital, you can go ahead, take you to the cath lab, do an angioplasty, open the vessel in front of your eyes. Olden days, if you go to a hospital, what we used to do, we used to give medicines to open these vessels. Now we have realized that it is suboptimal to do that, because what happens is, when you give an injection, you don't know whether it opens or not. But when you do an angiogram and do an angioplasty, you see the vessel, you look at this, you know the vessel is open, look at the flow below, it is beautiful. So you know the results and see the results. Now, this is going into a little bit more deeper to see what's happening. Now, don't go try to follow everything in this. The only thing I want you to understand is this process. What you see on the left side of your screen is a vessel that looks normal. And as age advances and as the time progresses, the blocks start increasing till a time when it is critically occluded. But when it gets critically occluded, then you have a clot that breaks up this, and that is when you have a heart attack. Now, I have a question for you. When do you think this process starts? How early you think this process starts? 10, 20, 30, 40, 50? How old do you think it is? Now, if you look at the timeline of this, as early as the first decade, this is starting for everybody. So I'm sure everybody are in your 20s, 30s, 40s. You all have the disease already going inside you. So it is all the more important that all of you should be going in for preventive measures and taking care of yourself. So what are the factors that we can change? What are the factors we cannot change to try to prevent this heart disease? One is age. As age advances, we saw that the continuum keeps going on. So age is something you cannot reverse. So you just have to accept it. Gender, men are generally more prone. Women are protected by their hormones till their menopause. But once they have their menopause, they are also more prone for heart attacks as it goes. The genetic factors, your family history is something we cannot change. So if you have a family history, what is family history? Somebody, either first degree relative, what we mean by that is either your parents or your brother or sister having a heart problem. Men in their 50s or women in their 60s, less than 60s, if they have a heart problem, that is only considered as family history. If your grandmother has a problem at 70 or 80, it is not family history. So somebody younger age group when they have, it's a family history. If it is there, you must be more conscious. Now, race and ethnicity is something important. Vasudha made a very good statement saying that Indians are more prone, 60% have non-communicable diseases. Now, we have had a very good statement on this about India. Now, what we did was we have an association called the Lipid Association of India. We came up with our own consensus statement on management of lipid in India in 2016. I was one of the co-authors for this particular statement. And this is what we had to say about the heart disease in India. Indians are 4 times have a higher incidence of heart disease compared to the Americans. And compared to the Japanese, we have 20 times higher incidence. And if you look at the number of persons who have heart disease, we have a very significant propensity to have it in the young. 40% of patients have this below 45 years of age. Now, 40%. Now, compared to this, the Western data in Americans is 5 to 10%. Now, this is extremely high incidence in the young, and we should be cautious about this. And we should remember that nearly 1/3 to 1/2 of these patients do not have any major risk factors. So lifestyle modification becomes very, very important. Now, apart from this, 2 other risk factors are very, very important in modifiable risk factors. I'm sure all of you remember this great quote from George Bernard Shaw. He said, "A cigarette is a pinch of tobacco rolled in paper with fire at one end and a fool at another." I think it was absolutely correct when he said in those days. And what it means is that smoking has got no benefits. It not only affects the heart and the lungs, it's going to affect practically every system inside your body. There's only one answer to smoking. Very simple answer. Just stop. Stop smoking. You don't have to say anything more than that for smoking. But what is the most abused part is the cholesterol. There have been several guidances and guidelines on cholesterol. And what you think is the most difficult part in managing cholesterol? In my clinical practice, the most difficult part of managing cholesterol is not the doctor, is not the patient. It is the lab report. Now, if you look at this particular gentleman, you look at him, he had a LDL cholesterol, which we call as the bad cholesterol. I'm sure all of you had heard the story of the movie Good, Bad, and the Ugly. The cholesterol has also got similarly 3 components. The good cholesterol, which is supposed to remove the cholesterol from the blood vessels back to the liver. The bad cholesterol is the one that pushes it to the blood vessels and blocks it. And the ugly cholesterol is now recognized as another factor which also contributes to the bad cholesterol. What is it? The HDL is the good cholesterol. The bad cholesterol is the LDL cholesterol. Now look at this reference value. This says the optimal value is 100, while what happens is this patient has got a LDL cholesterol of 90. He's already had a heart attack. And this says 100 is optimal. Now, if you look at this patient, if you are the patient, what will you do? You will tend to stop the medication or reduce the medication. So what happens in this case? In this case, the patient obviously will reduce the medicine. But what does the guidance say? Now, if you look at this, they call this as the NCEP 83 guidelines. Now, the biggest problem is that all these guidelines are all outdated. This is talking about the guidelines that came in 2004. If you look at most of the labs in Chennai, this is from one of the leading labs in Chennai. They quote this particular guideline, which is 2004. So what is the correct one? Is entirely different. The correct guidelines, this is the 2019 European guideline, which says for somebody who's had a heart attack, the LDL cholesterol must be 55. Now to get to 55, you're a long way away. And for a normal person, somebody who doesn't have any risk factor, what we call as a low risk person, the maximum of LDL cholesterol is 115. Now, do you remember this particular value? It says what is very high, what is low. Optimal is 100, near optimal is up to 130, borderline high, very high is more than 190. There is no way near the truth. This is one part. The second issue is the good cholesterol. Now, I'll update you a little more on the good cholesterol. There are a lot of people who keep coming and asking that their good cholesterol is low, how to improve it. None of the medicines to improve good cholesterol are effective. The only effective way of improving the good cholesterol is by walking, exercise, and maybe take a little bit of almonds and dry fruits. That's the only way it is effectively working. None of the other methods are effectively good. But nowadays, we don't concentrate much on the good cholesterol. We are more concerned about the bad cholesterol because in the good cholesterol, we are only measuring the amount of cholesterol. We don't check whether it really removes the cholesterol from the blood vessels. So we are not really concerned about the good cholesterol. So mind you, the bad or the LDL cholesterol is the most important. If you have not checked one, please check one. When to check one? Check early. In fact, the Indian guideline, we have recommended anybody who is entering college by 18 years of age must get their cholesterol checked because you start early, you're going to treat them early. That is important. So mind you, cholesterol is a very important component. But what does the future hold? If I'm a cardiologist, I want to educate you, I should go one step beyond the cholesterol. So what we do is we don't look at the cholesterol nowadays. We look at one of the components of cholesterol. You see these red spots here? All these yellow ones are the cholesterol molecules of different sizes, different particles that go and produce the blocks that I showed you. Now, if you look at the red spots, these are called the apolipoprotein B molecules. Remember the person who introduced me said that we developed for apolipoprotein B. What you see on the left is the apolipoprotein B app that I developed. Now, this app is going to calculate the apolipoprotein B. Now, this is the future. In future, we're not going to look at LDL cholesterol, the cholesterol profile. This shows all the cholesterol, and it is available freely in Chennai. So if you're looking at cholesterol, ask your cardiologist if you have a heart problem, or you ask your physician to check your apolipoprotein B. I will not delve into the values. It's going to bore you too much with statistics. Now, so far we have seen about smoking. We have seen about high cholesterol. Blood pressure, get it checked every time you go to the doctor. If you're not, every year or once in 2 years, get your blood pressure checked and controlled. Sugars, it's a separate topic, separate discussion. I'll let Vasudha discuss let somebody else discuss it on some other day for the diabetes, but get your diabetes under control. The next two are the obesity and physical activity. Very important in prevention of heart disease. What is your ideal weight? Very simple weight. You take your height in centimeters minus 100, that's the maximum weight you can have. So if your height is 170 minus by 100, 70 kilos is the maximum weight that you can have. Very simple way of finding out if you're overweight or not. I think all of you can calculate that. If you want to be a little more scientific, you look at your waist circumference. Now the maximum you can have for that, because this is the recent concept which we say is more accurate in showing heart disease. If your waist circumference is more than 90 centimeters for women, or 80 centimeters for 90 for men and 80 centimeters for women, you're obese and you have to come down on your waist circumference. That is also showing a very important future reference for you. This is going to be important. Now, how to lose weight is a big question that everybody asks. How much to eat, what not to eat, and what to eat, and how much to exercise. That's a big question, but I just give you one simple answer to that. It's a balance between what you eat and what you spend. If I go beyond that, I'm spending too much. But I'll just get one word on it for you. How much of exercise is recommended? Very simple concept. If you are a healthy person, you do about 150 minutes of walking every day, moderate intensity walking. That's going to be about 30 minutes of walking at least 5 days a week. If you're going to do jogging, 25 minutes, 3 days a week for 75 minutes is fair enough. But if you have a heart disease, hypertension, or diabetes, 40 minutes is recommended. That is going to be a simple modality of exercise. But nowadays, we're living in the digital era. Everybody's got a Fitbit watch or a watch that calculates the number of steps, and you have a mobile phone calculating steps. I think that's the commonest way. I do that. So I think all of you are doing that. So in that case, what is going to be the healthy amount of walking? For a normal person to do a reasonable amount of walking, 6,000 steps is good enough. But if you want to lose weight, you'll have to be doing at least 10,000 steps per day to start losing weight. Now, this is the latest thing that is cropping up, which is not spoken of very often. Sitting is the new smoking. How many of you are aware of sitting as the new smoking? You all know smoking is bad, but how bad is sitting? All of us sit in meetings like this. We keep talking, chatting, sit in the office, sit glued to the computer, keep sitting on the computer, don't work at all. Now, if you're going to be sitting for more than 4 hours, this is a very interesting paper that got published in 2019, mid-2019 in the American College of Cardiology. Now, if you look at the right end, you see the persons who are sitting, physically inactive persons, and this is the ratio, hazard ratio, or the risk of developing heart disease. If you're sitting for less than 4 hours, it's less. Sitting for more than 4 hours, the risk is increased. So anybody who's going to be sitting for more than 4 hours, the risk of getting a heart attack keeps increasing. 6 hours is more, 8 hours is the worst. But if you start looking to the left side, you see that this problem at 4 to 6 hours or 6 to 8 hours starts coming down. What happened here? Now, if you look at the lowermost part, you will realize for those people who exercise for more than 150 minutes per week, that is a recommended exercise, this effect of inactivity, of sitting, can be overcome. So all those of you who are sitting, I'm sure every one of us is sitting in the office for more than about 150 minutes, more than 4 hours a day. We should be exercising for at least 150 minutes to overcome this new smoking, which is the new concept. So I think all of us should get up and start walking. At least about 30 to 40 minutes per day is going to be mandatory. Simple things are useful. One, take the stairs. You stop using the elevator. Park your car a little away. I park my car half a kilometer away from my hospital, start walking every day. If you're going by bus, get down at least one stop earlier. At home, don't do everything in one shot. It might be more efficient carrying a lot of things and doing things, but don't do that. Do it slowly, deliberately, take more steps. Walk as much as you can, increase the number of steps, and it is definitely very, very effective. Now, this is something that evokes a lot of interest. Whenever I put this, everybody is happy. Now, this slide shows a beautiful collection of miniatures. Now, where is this? Very simple. This is there in my house. It's not my collection. Don't worry. Don't start laughing. Don't stop smiling. This is my dad's collection. My dad was a retired police officer. He's no more, and his own collection. Now, if you see here, there are two small plaques. Those two plaques are very, very interesting plaques. One plaque clearly shows the greatest enemy of man is alcohol, but the Bible asks us to love thine enemy. The second one is even more interesting. When you drink, you sleep. When you sleep, you don't sin. When you don't sin, you go to heaven. So let's all drink and go to heaven. Doesn't mean all of you drink and go to heaven. Now, there is a restriction on this. Today, we cannot recommend alcohol as a modality of treatment, because what happens is alcohol has been proven to produce cancers of the throat and the food pipe. So you cannot recommend alcohol. But still, there is a recommendation from the cardiac point of view that you can safely take a little bit of alcohol, which amounts to 2 drinks per day for men, or 1 drink per day for women, or small statured men. But you don't go more than 10 drinks per week also in this particular method of drinking. But please, if you're not drinking, don't start drinking. It doesn't mean that you should start drinking. So this is a very important saying, which says that tempora mutantur e not mutamur e nils. What it means is times change and we change with them. So the way in which we approach heart disease is changing, and the way in which we diagnose heart disease is changing. We put up a paper to try to overcome the treadmill test, where you have to walk on a belt and see if your heart is functioning well. So we developed an algorithm based on data mining algorithms, and we made a simple algorithm which uses age, gender, height, weight, hypertension, dyslipidemia. And this was published in the Indian Heart Journal. And this had a negative predictive value, saying that it was close to 80%. And in fact, when we compared it to the actual treadmill, which you want to say, we fared better than the treadmill in this particular test. So this is available as an Android app. It can be used. So times change, and we are looking at different modalities. But still, you cannot beat heart attack all the time. You win some, you lose some, and you still end up going. Now, this picture is actually taken by me. You like it? I can still send it across to you. Now, you still don't win all the times. You end up taking medication. But if you're going to be on medication, please don't stop medication without medical advice. Now, it is very important to remember, medications for heart disease are for life, unless your doctor says change, because it can be changed. But we are only not curing the disease. We are only controlling and modifying the disease. Remember that. Once the disease fails, there are 2 other things that we all talk about: the angioplasties and the bypass surgery. The difference between angioplasty and surgery is very simple. In an angioplasty, what you do is, if you have a block in a blood vessel, we go ahead and open it up with a stent. The other thing is, in a bypass, it's like a crowded traffic that's there inside the city. What do? You put a bypass road across and cross the traffic. That's what we do. Now, is there any other role? Now, most of the patients, when they come to you, they come with a fond hope asking, can I do without surgery? Can I do without angioplasty? That's the question. Now, is there a role? Now, in 2019, there is a big say on this, because what happened? We wanted to see if an invasive strategy, basically meaning either when you try to do an angioplasty or a surgery, or whether you want to give them an optimal medical therapy, how effective is medical therapy? Because medical therapy has evolved over the years. Our treatment modalities and the way we treat has improved considerably. But this has a very important sub point. It is not applicable to everybody. If you have a heart attack, if you have a heart failure, or if you have a very critical left main or a very important vessel disease, these data are not applicable. So don't go and bug your cardiologist and say that this is what I said, because when you look at the red and the blue here, the red is patients who had an angioplasty or a surgery. The blue line is the patients who had a conservative or a medical management. You see both lines are more or less similar results. Now, this is very important, because there are specific groups of patients who can be treated without surgery with a lot of medicines, and they are effective. Now, this is a very effective alternative, because the way in which we treat medically has improved tremendously, and there is a big scope for a conservative management also. Mind you, I'm an interventional cardiologist, but I put a preventive interventional cardiology in my name, because I push the preventive aspect quite a lot in my clinical practice. Now, before I conclude, before I say bye-bye to you on this, now I will bring you back to this particular slide. The reason why I put this slide is, remember what I told you, from the first decade, this problem starts, and we have to start looking at early. Why do we have to look at early? Is if you look at your cholesterol at 30 years or 40 years, if your cholesterol has been high at 18 years, there is what is called as a cumulative burden. Over the next 20 years, till you're 40, when you check your cholesterol, you have an increased cholesterol, and this keeps accumulating in your blood vessels and starts producing some amount of loss. So to avoid this cumulative burden, all of you should screen early, and all the modifiable factors. Basically, there are 4 major modifiable factors: the smoking, the diabetes, the hypertension, and the cholesterol. Modify all of them as much as possible so that you try to avoid it. Because today, what we say, heart attack in the young, if you're going to be in the 40s and 50s, now we are seeing in the 20s, like I showed you, in the young, is a failure of our preventive measures, not only by the doctor. Primordial prevention is prevention at the level of the society. Probably Rotary has also not educated the people adequately. So saying this, I think I will say thank you for the excellent opportunity given by Vasudha and the Rotary. I think I will not bug you too much. I'll give an introduction to heart disease and prevention and treatment of heart diseases. Thank you very much for your patient listening. I think I will stop my share and take up questions as and when they come.
Thank you, Dr. Prabhakar. That's a wonderful presentation, and you keep us the crowd in silence. Thank you for that wonderful presentation also.
Thank you, sir.
Now I request Vidya Srini to take up for a question answer session.
Okay. Hi, Doc. I think that was a really engaging presentation. You looked at it with different analogies, and we could really follow and relate to what you were saying much better than a hardcore kind of medical jargon-filled presentation. It was really enjoyable. Thank you for that. One of the questions which I think Jayapandi had asked was, how do we, about first aid at home? What do we do for first aid at home?
I gave a little bit of a measure about it when I touched on it. But if you are known to have heart disease, you have this tablet called Sorbitrate with you. Now, if somebody doesn't have a heart disease, don't try to give Sorbitrate, because sometimes it produces a big drop in your blood pressure. You might faint. So you have to be a little cautious when you give Sorbitrate to patients. In fact, I had one of my patients when I was a postgraduate in GH. This guy, there are 3 things you don't do when you have a heart problem or when you have a chest pain and problem. Never walk after you have a full meal. Don't carry a weight and don't climb stairs. Now, what this guy did, he was going to the station, to Egmore station, and he was late for the train. He was carrying a box. He was climbing the stairs after a heavy meal, and he was running up the stairs. He developed chest pain. He took one tablet of Sorbitrate, kept it under his tongue, and immediately he dropped down, fainted and dropped down. So when you use this tablet of Sorbitrate, you lie down or keep them in the slanting position, give one tablet to be kept under tongue. If not, what you do, if the patient has a chest pain, loosen his shirt, make him breathe with comfort, put him in a semi-slanting position. They have giddiness, put them flat. In fact, if they have severe giddiness, you can also lift the legs if you want. It's not going to harm them. If you have severe giddiness, if there's no giddiness, you don't do all that. Actually, it will produce more strain on the heart. So keep them in a semi-slanting position. Call help immediately. Time is essence. Don't delay time, because most of the deaths in heart attacks, nearly 50% of the deaths in heart attacks, happen before medical help is taken. So you have to rush to the hospital, take them to the hospital. Otherwise, nothing is going to work. Sorry. It's not supposed to ring at all. Okay, sorry. Sorry about that. I have muted my phone. This WhatsApp, I didn't know how to mute that. Right. So as I was saying, so keep them in a semi-slanting position and get them to the hospital as early as possible. Don't try to meddle with them too much. And don't try to feed them anything, because they sometimes vomit and the whole thing aspirates and goes into the lungs, and that might actually kill them. So in these patients are very sick, don't try to feed them also, because that can also be dangerous. I think the best thing is try to rush them to the hospital as early as possible.
Okay. Thank you, Doc. That is insightful. Our next question is from our District Officer, Venkatesh Narayanan.
Yes.
And his question is, what is the role of blood perfusion study in deciding whether the intervention is necessary or not?
Okay, I think he's asking about the nuclear scans that I think that's what he's talking about. Okay, now that is also there. Now that's a very useful test, because what happens when you do a perfusion study is, there are 2 things in which it is useful. Since he's asked a very technical question, there are 2 ways it works. One is it shows whether the tissue is alive. Like if you have a heart attack, what happens in a heart attack? You have a heart, you have a blood supply that is blocked to, let's say, these 2 fingers. So if you have these 2 fingers that have a blocked blood supply, this is not going to function. But the moment you do an angioplasty, the blood supply is partially restored. Or you do give those blood thinner injections, it opens up. Then you have a block. Then what do? You want to know whether the tissue is alive. You do a perfusion study, you know whether the tissue is alive. Then subsequently, you stress them and find out if this tissue is going to improve if you improve the blood supply. So this helps in 2 ways. Now, if the area of jeopardy is huge, then probably you will have to go for an intervention. But if it's a very small area, which is not having enough blood supply, medical management is good. I gave you a clear question stating that there is a big role for medical management in future, meaning that not everybody requires an angioplasty and a surgery. It is important, but it does not apply to heart attacks. Remember, it is very, very important. It does not apply to heart attacks. That's very, very important that you have to remember. Heart failure, heart attacks, and those with some specific diseases like the most important vessels, large area of jeopardy, you don't do with medical management. But nuclear perfusion studies has a definitive role.
Yeah. What happened?
I just request everybody to mute themselves because we're getting a lot of background talk and noise. Please, I think everybody can hear me. Thank you.
I can mute everybody because as a host, anybody can mute everybody. You can mute everybody and whoever wants can unmute themselves. I'll mute all.
Still, I think somebody has unmuted by mistake.
Yeah, I think Jay Pandey had muted everybody, but sometimes people unmute. Okay. Yeah, dear, carry on, please.
Yeah, the next question, maybe Reggie, you can ask yourself.
Sure. Thank you, Doctor, for the insightful presentation. You did mention that physical activity has a potential of reducing heart diseases. Just one question from my age point. Will revival of physical activity, will it reverse potential heart issue later in future? Could that be seen as a preventive measure? What are your thoughts? Any studies done on that?
You said at your age, you never mentioned how young you are.
I'm 45.
Okay. Basically, it works like this. See, there are basically we have had several studies to show reversal of heart disease. What is reversal? Remember, I showed you that that picture where there is an increase as age advances. Now, everybody likes to reverse that. There are only two medicines that have been very effectively shown to reverse it. One is physical activity, exercise, and two is the cholesterol lowering. Absolute cholesterol lowering, less than 50 milligrams of LDL cholesterol. If you have a block, the bringing it down to less than 50 milligrams has two effective works. One is going to be to reduce your cholesterol and reverse disease. And two, these blocks need not always be very big. These blocks can be unstable. These unstable blocks are the ones that produce heart attacks. Not everybody with a 90% or a 95% blocks goes in for a heart attack. Only when it becomes unstable, it produces a heart attack. That instability, that unstable status is blocked by the cholesterol lowering medication, which is effective. But you answered your question specifically, at any age, physical activity is very effective. And it not only is useful in reducing the heart disease, it can also reverse heart disease, definitely reverse heart disease. It has been clearly proven at any age it is effective.
Thank you.
So 45 was just a joke to ask you.
Yeah, Narendra, just ask your question, please. Narendra, please unmute yourself and ask the question.
Doctor, if a person who has undergone for this angio, the stent was used to the stent.
Yeah.
Is that any time